to begin also by thanking Arnek for the invitation. It is always a great honor and pleasure to participate in these conferences. I always leave feeling extremely stimulated and have wonderful, productive conversations with people from across the region. So, to begin with, I'm not a climate change expert or a climate change scientist, but as was so clearly articulated by Dr. Dora this morning in his presentation, it is incumbent on all of us in the child development community, whether we're practitioners, we're researchers, advocates, or policymakers, to really become more well-versed in understanding the climate challenges and how they impact the youngest citizens. So we understand that children are really the most vulnerable to the effects of climate change. It is really the next generation that is going to inherit an earth that is very different from the one that we inherited from our grandparents and parents. And the developing child, this is the youngest children that we're really concerned with, is more susceptible than other children, than adults, to the effects of environmental toxins, environmental pollution, and to the climate change crisis. So urgent action is needed. And in a Save the Children report, it was estimated that for every year in the next decade, close to 175 million children will have their health, education, and protection impacted, both in the short term as well as in terms of their long-term life trajectories as a result of exposure to these climate change events. So every aspect of the nurturing care domains, this framework that WHO launched last year, will be impacted, whether that's their health, their nutrition, their learning opportunities, and their protection, as well as the impact on their nurturing and responsive care. So in terms of their physical health, we know that heat-related illnesses, exposure to pollutants, toxins, will increase risks of infectious illnesses and parasitic diseases, which are more prevalent in warmer temperatures. So there can be sudden climate change events, such as floods that we've seen in Bangladesh, or rising sea levels, which we know in this region is of particular concern in the Pacific Islands. So what would that look like? Well, in Bangladesh, it is estimated that 19 million children will be threatened by environmental disasters such as cyclones or floods in the coming years. So this really is a challenge that we have to think about and plan for the next generation. And as a consequence of that, the number of cases of diarrheal illnesses will increase for every amount of increase in rainfall over the average or typical rainfall that the country experiences. That will put a burden on maternal and newborn child health services. It is not just the physical health of children that will be affected, but also their psychosocial health. And there is evidence to suggest that climate change risks increase risks of depressive symptoms, children's mental health, their behavioral health, and their learning or cognitive well-being. In nutrition, it is estimated in a report by IFPRI that by the year 2050, and I'm sorry I missed the year there'll be 20% more malnourished children in the world than would be the case without climate change. So when you think about the incredible efforts that we have to make just to accelerate action to combat malnutrition, that effort, the investment in those resources will only be increased because we are also tackling this global challenge that is going to impact all of us locally. In terms of education, there are direct risks in terms of climate change events that could destroy or damage preschools, ECD centers, as well as other schools, as well as indirect impacts because of family displacement, migration, increased economic hardships, which means that families may well be placed in making difficult choices. And of course, displacement and migration, which is already a huge challenge for us, will put increased or heightened risks with respect to children's safety and protection. And it's not just at the level of the child, but also at the level of the caregiver. These are stressful events. And stressful events have been associated with increased poor functioning within families, such as domestic violence. And that, of course, will then have an impact on the care that families can provide. And there is some evidence to suggest that there are already gender inequalities that we see, but these things may also exacerbate gender inequalities. So work following children exposed to floods in Nepal and Pakistan, in both cases saw larger impacts, greater risks to girl children compared with boys. So what is it in terms of actions that we have to think about in our community in terms of how we continue to protect children's well-being and promote children's well-being? I think there are three actions, and the first is really about ensuring that we continue to provide a protective, nurturing care environment and reduce the risks of toxic stress. So just as a very brief reminder, all children experience a healthy amount of positive stress. First day of preschool increases the heart rate, but children will recover quickly. And then there is more tolerable stress, which is under heightened risk. Children may experience a stressful situation, such as when they're exposed to a natural disaster. But they're protected if they have a protective caregiver, a stable caregiver in their lives. And we want to ensure that that doesn't change in extreme circumstances, so that we're not transitioning from tolerable stress to toxic stress, which does much more harm to the developing child. So in terms of work where children have been followed after exposure to natural disasters, this work from Chile showed that before the earthquake in 2010, about 5.5% of children had been exposed to a traumatic event. But after the earthquake, at least 80% of children reported one stressful event, and 40% of children were experiencing two or more stressful events. And when this was translated into unmet needs, about a fifth of children had unmet needs in important aspects of nurturing care, such as stability of the caregiver, protection, physical, nutritional health needs, as well as psychosocial and learning needs. Work from Japan post the earthquake showed that children that continue to have a protective, stable caregiving relationship had less negative outcomes. They were fine. And so really the take-home here is that we need to continue to put our efforts into ensuring that we equip caregivers with the skills, the knowledge, the behaviors to continue responsive care. And we need to look after not only the youngest children, but also their families, also their caregivers, their parents, so that they are able to provide that support when stressful circumstances happen. So it's important that we continue to plan, invest, and promote nurturing care in this context of climate change, not just for the extreme events, but also because it will build resilience in our communities. So the second is making sure that we leverage multi-sector coordination and planning. And this really needs to be invested in now. And we need to continue those efforts. It's complex, it can be messy, it can be overwhelming. But we have to find examples of good practice. And just to illustrate this, work from India showed that with increased rainfalls and heavy rainfalls, there was much higher risks of children having diarrheal illness, 1.5 to 2.6 times, compared with the typical situation. And drought exposure for young children in Ethiopia showed increased risk for poor growth. And girls were more at risk than boys. So this cannot be the responsibility of the health sector to tackle alone. It would only be effectively tackled if we connected the dots between health and WASH, or water and sanitation and hygiene infrastructure, or health and social protection. And so it's really a shared whole-of-government approach that has to be in place for young children. And thirdly, the last key action that I think we need to reflect on and think, particularly at this conference, is as we celebrate and look at 30 years of the CRC, how does this change or impact in the current context of climate change? So in a survey from Australia, which looked at young children through to youth, it showed that 96% stated climate change was a serious global issue. Close to 90% were worried about the impact of climate change, but 70% expressed their voices were unheard. So it's critical to have age and developmentally appropriate communication with children about climate change, but also to include them in actions or to be their advocates for the very youngest children who cannot speak for themselves. So there is rights-based frameworks that we have, such as the United Nations Framework Convention on Climate Change, but it doesn't mention children, even though it calls for preserving the global climate for present and future generations. We know that in this, wealthier nations have an obligation to support less wealthy nations address the consequences of climate change. But really, we as a community need to think about what is our shared narrative about climate change and young children. What is the story that we can tell powerfully that will support advocacy, that will support communication, that will support policy and actions, that will ensure that the needs of the youngest children are met during this crisis, and that allows communities and local leaders to really connect with the very global issues and the huge issues that climate change presents. So in summary, nurturing care is important in every scenario. Its importance is even heightened in terms of the climate change crisis that is upon us. So supporting resilience in young children, in their families, in communities, and in the systems that support them cannot be lost. And so we need to continue our efforts in actions that mitigate and address climate change. Thank you.